Scientists at Washington University School of Medicine have shown that a simple and rapid blood test can predict within a day which patients with COVID-19 are at the highest risk of severe complications or death. The test could help predict disease severity and facilitate clinical trial design by identifying patients who could benefit from specific investigational treatments. Determining within the first 24 hours if a patient needs dialysis or intubation could also change patient triage and management earlier. Findings from a study with patients first diagnosed in Wuhan, China, show that nearly 76% had at least one symptom 6 months after symptom onset. The study included patients discharged from Jinyintan Hospital in Wuhan who were diagnosed with COVID-19 between January and May and were followed to June and September. 3/4 of the patients had at least one ongoing symptom 6 months from symptom onset. The most common ongoing symptoms include fatigue, sleep difficulties, and anxiety or depression. Scientists at the University of Cambridge and Cambridge University Hospital NHS Foundation Trust have developed a DNA test to identify patients at risk of secondary infections so that antibiotic treatment could be initiated. Patients who need mechanical ventilation are at a higher risk of developing secondary pneumonia while in the ICU. Also, patients with COVID-19 are twice as likely to develop secondary pneumonia. Confirming a pneumonia diagnosis can be challenging, but the Cambridge test allows for faster and more accurate testing. According to findings from a large study, COVID-19 patients admitted to the ICU had a higher burden of delirium and coma than is typically found in patients with acute respiratory failure. The choice of sedative medications and limitations on family visitation may have played a role. Findings highlight the need for careful management of COVID-19 patients during the second and third waves and use of lighter levels of sedation, frequent awakening and breathing trials, mobilization, and safe in-person or virtual family visits. There is a 7-fold variation in rates of euthanasia across the Netherlands, according to new findings. The Netherlands was the first country to legalize euthanasia. Preliminary legislation was introduced in 1994 and became a law in 2002. The number of euthanasia cases has continuously increased since 2006, but they have doubled from just under 2% in 2002 to over 4% in 2019. These findings could be relevant for countries that have legalized euthanasia. This was the 111 News from ICU Management and Practice. Visit our website for more stories, download our journals for in-depth information, and subscribe to our highlights.